Hey, my name is Kara. I'm an ultrasound tech, and let's talk today about what a subchorionic hemorrhage is, or it is also referred to as a subchorionic hematoma. So basically, you can think of this as a small cut or a bleed between your uterine wall and the outermost part of the sac of baby, so the amniotic sac. The blood basically collects underneath the chorionic membrane, which again is that outermost layer of baby's sac, and that is where it attaches to your uterine wall. So there's going to be a space between there where the blood is collecting between them because it is coming away from the uterine wall. Now, I know this sounds super scary to have the sac coming away from the uterus, but in the majority of cases, it does resolve on its own. And as long as it's not a large bleed that is causing a lot of vaginal bleeding, it usually just resolves on its own and there is no additional follow up needed. And it's actually pretty common to have a subchorionic hemorrhage seen on ultrasound in the first half of your pregnancy. And it does account for about 10% of all bleeding in that first half of pregnancy as well. So please don't freak out if you are going to your ultrasound and then afterward your doctor is telling you that there is a subchorionic hemorrhage. Again, most of them do resolve on their own. The most common symptom that you are going to have when you have a subchorionic hemorrhage is vaginal bleeding. A lot of the time it is just light bleeding, but in rare cases it can cause a lot of bleeding and other complications such as a miscarriage, preterm delivery, or even a placental abruption, which is where the placenta actually tears right away from the uterus, is all possible when you have a subchorionic hemorrhage, but these are all pretty rare complications to experience. And doctors actually aren't sure why this happens, but if you do have a history of certain conditions such as uterine infections, uterine trauma, or having high blood pressure, then you do have an increased risk of having a subchorionic hemorrhage. And as for classifying how big a subchorionic hemorrhage is, we are going to measure it in 3 dimensions, but the biggest thing is just to compare it to the size of the gestational sac. So if it is less than 50% of the size of the gestational sac, we don't really worry about it too much and we call it a small subchorionic hemorrhage. But if it is bigger than 50% of the sac, as in it is greater than 50% of the gestational sac size, that is considered a larger subchorionic hemorrhage, and you may need extra ultrasounds, or if the bleeding is really heavy, your doctor might also recommend you go on bed rest. And I thought this little diagram was pretty helpful in just conceptualizing what a subchorionic hematoma is. So you can see that baby is in the sac over here. The blue area all around baby, that is the amniotic sac. And you can just see that the subchorionic hemorrhage is actually this darker red part over here. And it is basically just that blood collecting between this outermost layer of the amniotic sac of baby and the uterus, which is over here of mom. On ultrasound, this is going to look like a hypoechoic area that is around the gestational sac, but it is usually not as hypoechoic or as dark as the gestational sac itself. So here you can see this kind of circular area here with the baby inside of it. Baby's right here is the gestational sac. And then over to the right here, so this area here, which is not as dark as the gestational sac because it contains blood instead of just straight fluid. This is going to be the subchorionic hematoma that they are showing here. You can appreciate that this area here is not as big as this over here. This is less than 50% of the size of this. So since this bleed is less than 50% of the size of the gestational sac, which is all up over here, it is considered a small subchorionic hemorrhage. This one, on the other hand, is a lot bigger. So again, over here is the gestational sac, and you can see baby within it. But over here, this big kind of blackish, grayish area over here is going to be the bleed. And you can even see that they labeled it bleed on the picture here. And then over here where it says SAG, that's actually the gestational sac. So again, you can appreciate that this area here where the bleed is more than 50% of the gestational sac size. And the gestational sac is again over there. So therefore, we are going to classify this one as a large subchorionic hemorrhage. And this is going to be at a higher risk for things such as heavy bleeding. And therefore, your doctor may recommend bed rest and more frequent ultrasounds if you have a bigger bleed, such as the one shown in this picture here.